So thank you for joining me today, and I'm going to be sharing some slides to illustrate the work that Somerset Carers Service do. So as we were saying, do ask some questions in the chat. Myself and Fiona will answer them. So to start with, I'm going to start with a bit of the background. So as you can see on here, this is a picture of our carers packs and some of our carers information. And when you look at this logo here, this is CCS, which is the Community Council for Somerset. And they were formed in 1926 as a rural community council. And they were established to facilitate communication between the community and governing bodies by sort of talking to people, getting their ideas and their opinions. And in 2012, CCS started the Village Agent Scheme, which is to reach out into rural areas to ensure that people who weren't connected were aware of the support available to them. So when we started out, I say started out, I was about 2 years in, I think, but there were about 8 of us, and we'd hang out at village coffee mornings and sharing information and beginning to earn the trust of clients to help them to find solutions to their issues. So fast forward, now the model extends out to the carer service contract, which is this one here, and that's from Adult Social Care. We've got hospital discharge with the NHS, GP surgeries, social prescribing link workers, and it just goes on and on. So we now have a triaging scheme and referral routes because we're doing so well. So unfortunately, we don't get to hang out in coffee mornings anymore. We've come on incredibly. So today I'm focusing mostly on the carer service contract with the new contract that started in April 2024. But because our services are all interlinked, there will be a lot of work about the village agents' work too. So here we're talking about carers and the need for support in the carer service. And I'm not going to read all of those out to you because I think they're quite good for you to be able to roll your eyes over as you like. Some people like statistics, some people don't. But carers' work is often undervalued, often unseen. People sometimes don't identify as a carer, so they don't know what support's out there. They're not provided with training, and sometimes they haven't even agreed to be a carer. We know society can't afford to pay carers for the work that they do, so we must spend what money we have wisely to support them to continue the incredible work that they do. So as part of that, Somerset Council commissioned Somerset Carer Service to provide community and digital support for carers, and also to work with other agencies, as we've said, such as the NHS and charities, to deliver a united and complete service for carers. Just as an offside, if you would like to read more about the current needs and statistics that carers raise as important to them, have a look at the new Carers UK State of Caring report, and it highlights mental health and financial support as 2 main issues that carers face. So if you go into Carers UK and you go under the news section, it's just under there. So it's a really interesting read. So flying on, here in a nutshell is our main slide that summarises pretty much what we do. So we're listeners, we're a support for when you're feeling low, and most of all, we're solution finders. So we offer one-to-one carer support, and that's available to help you to unravel your issues and just to listen to how you feel, and then help you to come to those solutions on ways to make things a little bit better. And Fiona, who's up there with me today, she's one of our carers agents who goes into your home or meets you in a coffee shop or wherever you would like and helps you to be able to do that. So many of our carers agents are also carers. They've also listened to many carers. They understand how you're feeling and they are there to listen. They understand the complex emotions around anticipated grief, bereavement, financial struggle and isolation that carers may feel. And they're loaded with tips on things such as how to support people living with dementia, how to get respite, how to get mobility aids, for example. And we've also got access to grants to help with the cold. We're also able to find second-hand items such as reclining chairs, mobility scooters. We can signpost to other grants. And we have a good but not complete knowledge of funding from adult social care and how benefits. And we can also apply for things like the Household Support Fund and Surviving Winter Fund. I'm going to move on from there onto the next page, but shall I take a pause for a minute and see if anyone wanted to pop in there, or shall I fly on?
We haven't had any questions in the Q&A yet.
Brilliant.
Has anyone got a question they want to put their hand up for, or should we move on? I reckon we should move on, Kath.
Perfect. One of the things I haven't mentioned there actually is that we also offer carer support phone calls. So those are for people who are feeling isolated, can't always get out to things like the carers groups. And they're offered by volunteers, and they offer a general sort of chat and befriending. We're also working on strategic development boards and groups to share the voice of carers. And also we're all working together, as we said, to develop the offer for carers in Somerset. So there's absolutely loads going on behind the scenes. So I've just put some little pictures in here. So these are some of the events that we've held for carers. So we've had a couple of days over at Holcott Manor with spa days and cream teas and Tai Chi. We've done walks. This one's on Ham Hill. You can probably guess that if you know Ham Hill. We've had nature days. This is Frog's Life over in Frome. You can see we were making I can't remember what it's called now, but we were making things. It was lovely. This is our sort of Christmas parties, and then this was a Tai Chi session. We do quite a few of those. So just pictures to illustrate what we do. Oh, and this was the Jubilee up in Kenton Mandeville. And we did some wet felting here, and I've still got mine framed on my wall because I was so proud of it. So moving on swiftly. So again, this is the work that we do. Again, trying to put it in a nutshell, because as we always say, when you ask us what we do, it's easier to say what we can't do, because we will try and solve everything as much as we can. So as you can see, Somerset Village Agents, we're part of the whole Connector Agent offer from Community Council for Somerset. So we've created a network of links across Somerset community with other services and charities, and our help is far-reaching. So we're working, like I said, in collaboration with many other organisations, so that the offer and experience for carers, we don't duplicate, but we know what each other's doing, so we can signpost to each other. We were just saying earlier, it can be a little confusing as to what type of agent it is. We're also known as connectors, but we're all doing the same work in a slightly different way to slightly different audiences and from slightly different funding pots. So examples are village agents who attend local meetings to share the support that's available and to help at a strategic level. And carers agents are working, so we're also working at the strategic level on the 2024 Commitment to Carers document. So we had volunteers, carers agents, village agents all coming out to share their different perspectives to help write that document. And now Health Watch are overseeing that to ensure that the objectives are filled on that. The carers service coordinators work alongside Spark Somerset on the Somerset Dementia Network service. Home First agents work with the hospital discharge team to ensure carers are aware of the process of discharge, what support and information is available to them in hospital and afterwards. And we're also working with both Musgrove and Yeovil to develop communication for carers and care for in hospital as well. As you saw from our first picture, we've got the carers packs we've developed, and we've negotiated a discount on a national carers card. So if you're interested in that, then do get hold of us so you can get that particular discount. We also train the carers champions that you now meet in your surgery, and we hold an annual meeting for them as well. So we can help find respite, we find mic providers, and we work alongside adult social care with the community agents to make sure that everyone can get the service that is out there for them. So again, a couple of little statistics that we've just pulled off. So from April 2024 to January 25, so it's about, what, 3/4 of a year, 9 months, the Village Agent Scheme has received 701 referrals, and we've received over 600 requests for help over the last 3 months for assistance with winter challenges. And we've given support and advice and access to grants and connected people who are less lonely and isolated. We've also created conversation clubs, which are warm, welcoming spaces for women from diverse backgrounds who may find speaking English language difficult. So it enables them to come together in a warm and a safe space, so they can receive information as well as meeting new people. So we're always trying to find different ways that we can improve the service that Somerset is able to offer carers and those that they care for. And I don't want to name other counties, but my sister works in a different county, and she works as a social prescribing networker, and I can tell you that they don't have what we have, and it makes me feel really proud when I see what we do, and I realise that it isn't necessarily everywhere else. So it is quite incredible. So I hope you've had time to listen to me speeding on there and read the slide as well, because obviously what I've said is not what's written on the slide. But is there anyone wants to interject there? Because I know I am flying through.
Yeah, there is a question in the chat. It says, can you help to get me a carer's assessment, as I'm going around in circles and have now given up?
Absolutely, it makes absolute sense to come to us, and we can unpick why that's not happened, and we can work with you to make sure you get there. We're also going to be having some carer information days over the next year, so depending on where you are in Somerset, those are designed so that you can get your carers assessment a lot quicker by working directly with adult social care who are working with us to create these information days, and they will be speeding up the carers assessment process. So definitely do come to us, and we can support you there, definitely.
Thank you.
Bessie's got her hand up. I'll just allow your microphone and your camera. You should be able to unmute yourself now.
Hi, Kath.
Hiya.
The issue with the carers assessment is with social services. As I said, I go to social services, they're moving me on to somebody else, then somebody else has suggested I have to go to social services, so I'm pulling my hair out.
Well, you're in the right place certainly to talk about it.
Yeah, I'm one of the service managers for the Taunton and West Somerset Adult Social Care team. So if you wanted to, if we can try and make contact outside of here, then we can try and point you in the right direction.
That would be great. Thank you.
Brilliant. And our role would be, I mean, you've come to exactly the perfect place to get that directly from adult social care. But what we would do is try and unpick where the system might be going wrong, and then make contacts to try and support you with that. But hey, that's brilliant. You've been able to jump that and get the support straight away. So that's brilliant news. So this is our website. If you have a look at the top of here, you've got this pink button. I know you probably can't see it very clearly, but if you would like to refer into our service, if you click on so that button, Fiona, I might need your help here because I can never remember. Is that the referral button or is that the register button?
So the pink button is the Get Support from Somerset Carers, and you will get through to the referral form that way.
Perfect. So the referral form is will then go into a system which will be triaged, and some days it might be Fiona triaging it, or it might be somebody else. We spread it across the county, and then your information is sent to your local area, and then your local carers agent will be able to pick that up and then offer you support, which will be, they will know all about the things in your particular local area. So we've also got on here, and is it this one, Fiona? I can't see it on my screen. We're looking at, so if you can register as a carer as well, you will then get our regular newsletters and updates. But also it's really good because the more people that we know about who are carers and identify as carers, all the more statistics and information we've got is always super helpful for being able to demonstrate the need and demonstrate what we do, and hopefully get more funding. You never know. So it's always really good to, the more information we've got, the better it is. We've also got a carer forum, which is there for people to chat to each other digitally and support each other. We've also got on there a carers hub, which is where we put all of the information about local services, and you tap in what it is you're looking for, and then it sorts it through and tells you what there is. We're always updating that, so it is generally pretty good and up to date. We are also in the process of developing a bigger digital platform and support for parents who have children, adult children with additional needs and disabilities. I think that's pretty much it. We're sort of looking at rewriting a lot of this and putting some more content on it. So if you've looked at it before, come back to us again and keep looking, because it is going to be updated quite a lot over the next few months. So I think that's probably enough on there. The mapping tool that it says on the side here, this is so that you can find the care in your area. We've also got the carers groups on there, and you can click on your area and find out which are the local carers groups to you. And we've also got a calendar on there so that you can see where they're running and what time they all are. So I think that's probably everything on there, unless you've got anything else you could add to that, Fiona.
As I say, the map on there is really useful because it will just show you where your nearest carers group is. You just click on the icon and it will have the updated information, because we've got flyers out there with carers group information, but because they're so fluid and can change due to the carers' needs, the printed information can sometimes just be that little bit out of date. So the website with the map just shows you really easily and clearly where your nearest carers group is and who to contact to find out information about it.
Oh, that's brilliant. Thank you. And as if by magic, look what the next slide is. So carer support groups are places that carers can meet so that they get to know each other. I mean, one of the things that people say a lot is that the isolation of caring is awful. When you're going through this journey on your own, you do have friends around you, but sometimes you don't want to burden them with the reality of the situation. Same with your family. When you're meeting people who are going through the same thing, it just makes life so much easier. So you share ideas, things that work well, confess to things that didn't go so well, and get it off your chest when you feel you need to. It says here we've got 20 plus groups across the county, and that's exactly as Fiona says. It can tend to be fluid. So we've always got new groups online. We've got some that we decide not to pursue because they we may find that there hasn't been enough take up on them. So as we said, they are fluid. It is good to phone in before you attend a group for the first time, like Fiona said, in case you've seen an old flyer. So here are some pictures of us in action. So here you'll see some of our carers groups have got activity groups that are run by trained, so they're normally mic providers. They're self-employed, trained, insured activity coordinators, and they're also supported by a volunteer, so you can come together with the person that you care for, which is often a lot easier because it feels, it just feels easier sometimes to come with the person that you care for rather than on your own. And also, of course, if you're struggling to find respite, it's great to be able to bring that person with you. Then you split up into 2 rooms. They're usually adjoining rooms, and then the people that you care for go and do activities. We get them all laughing, build them up with lots of chat and conversation, and then bring them back to you smiling, laughing, and hopefully a little bit tired, so they'll have a snooze in the afternoon. So, the idea is that you can really share with people that understand, and they're not judging you, but they're going to instead, fill you with compassion and understanding and ideas to help. And it's nice to have a reason to get out. I remember someone famously said to me, "Oh, Kath, it means I can go and get my lippy on." It's a place to indulge in a nice cafe or something, cakes and things that we might bring with us. We also invite agencies and professionals to share the information and support that they offer as well, so that carers really know what's out there to help them. And carers become connected. They're more like a workforce who are offered training and information and asked for their opinion. And this in turn improves, obviously, the quality of life of the cared for. So, they're all the different carers groups. They are different across the whole of Somerset. So if you go to one and you think, that's not for me, do try another one. And they're different, I think, because of the different venues. So like we said, some of them are in pubs, some in cafes, some in village halls. They're led mostly by volunteers, so different volunteers have different styles, and also just to the number of people who go to different groups. So do definitely try a few. And as we said, the up-to-date listing is here. So do go on, like Fiona said, and find it. So is there any questions about groups, do you think, or anything that we can add? No, I think we're all good.
I was just going to add that the carers groups are really good for unpaid carers that can get out to them, because I always say that the actual carer is the expert in the room on the person that they're caring for, and the support they can provide to each other is amazing. And a lot of the carers groups that I've gone to, the support that they give each other is just second to none.
Brilliant. And of course, they're the people who are experienced. They know what it's like. So, you know, they're the ones who can give you that sort of first-hand information that, oh, I tried that didn't work, but I tried this and this worked. Yeah, so it's brilliant. So we've also got the talking cafes as well. Now, these are run by the village agents, and again, they vary. So they're generally weekly, whereas the carers groups are monthly. And some of the cafes work as kind of private drop-ins where you can go and see the village agent and get the information and support you need. And others are kind of real social events where everyone joins, and a bit more like the carers groups, where they offer mutual support and conversation and laughter. And as you can see, there are 30 of those. So there's more talking cafes around than there are carers groups. But again, they also vary with where they are. So some might be in the library, some might be in a community centre. They're kind of all over the place. And again, you'll find there's a listing on the village agent website for those. Now, one of the things we're looking at the moment, as we said earlier, is that we're having we're working on the information and support that we provide for carers of adult children with disabilities and additional needs. So these are the people who have, so they're parents who have children who've gone through the education system and now are looking through into transitioning into adult services. And we're aware at the moment that we haven't got a huge amount of information, so I've written quite a bit of information, and we're looking at starting specific carers groups and meetups. So as you can see there is a consultation there, which is really for me to be able to understand exactly what people need, and so I can answer the questions that people ask me, and make sure we get it right. So if that's the type of care that you offer, please do that consultation for us. And I think I mean, I keep putting it out on Facebook. I'm just thinking we could try and put it in the chat, but I obviously haven't got it there, so I'll have to pop it in the chat at the end, I think. And we're also, as we said, we're expanding our digital offer for carers. So we've also got a consultation to find out, again, what sort of things people would like, what would work well for them. So again, I will try and get those into the chat at the end. The other thing that we're also involved with is open mental health. And I'm presuming, I'm hoping a lot of people have heard of open mental health now. And this is, again, where all the different agencies have got together and are working in a network to be able to offer support to, you know, a united support where we've got lots of different things and we all know what's out there, so we can signpost to each other and ensure that you are able to get the support that you need. And part of that is the calls for carers that we're doing. We have a specific mental health carers group, and we have the mental health carers service support as well. So this is pretty much what we're up to. So you'll probably see these flyers around, and if you've got a carers pack, you'll see one of these flyers in there. And again, if you go onto the Open Mental Health website, you'll find more information on that. And then I think our very last slide there is just our contact details. So we've got our advice line. Well, you can see exactly what it is, so I'll leave that there and just open up for a last couple of questions before I pass over to Wendy.
We have had a question, Kath. So Ilse asked, are these events during the day, as I'm a full-time worker and use my overtime for emergencies at home?
Absolutely. We do have at the moment, we've got an online evening carers group. So yeah, these ones are during the day because we're finding, generally speaking, that it's people who are not working that want to come and do face-to-face groups. But we do have an online one, which is every 4th Tuesday of the month. And again, that's on the website and is advertised. If there is enough appetite for it, then absolutely we could put something on in the evening face-to-face. But it's having enough people that will go there regularly to make that worthwhile. So please do come on and try the online one. It is actually, once you get used to it, we do have sort of good warm chats, and you know, it is a really nice environment, so do give us a try. Brilliant. Well, if there isn't anything else, I don't know if you wanted to finish off with anything, Fiona, and otherwise I'll quickly get my slides off and let Wendy come on.
No, I think we've covered a lot there.
It was very fast, but we're actually running down on time, so it had to be speedy for a reason, I think. So I'm now going to try and stop sharing, and there it is. There's my sign, and pass straight over to Wendy from the Alzheimer's Society. Are you? Let me take that off. There we are. Brilliant. So over to you, Wendy.
Thank you. Well, hello everybody. My name is Wendy Stevens and I work for the Alzheimer's Society, and I'm really excited today to tell you all about the Time for Dementia programme, and I hope that whether you're caring for somebody with dementia or not, that that this will be of interest to you. So I'm just going to try and get my slides. Hopefully it works. Okay, lovely. So what is Time for Dementia? So Time for Dementia is a unique, award-winning educational programme which has celebrated our 10-year anniversary last year. The aim of Time for Dementia is to improve students of healthcare, so that's doctors, nurses, I'll show you a list in a minute, all the different healthcare professionals, but trying to change their knowledge, their attitudes and their empathy towards people affected by dementia and their carers. So how do we do this? So typically healthcare students learn about dementia or may not through lectures, classrooms, perhaps following their colleagues around wards and on placements. But what we do is just a little bit different. We pair up students with a family living with dementia, and those students in pairs, they visit their family in their own home up to 6 times over a 2-year period. So every academic terms over 2 years, the students in a pair will visit their family, and the students will stay with that family throughout the duration. So just to give you an idea of scale, because this is a big programme, it's been running since 2014, and in that time over 2,500 families living with dementia have actually taken part in the programme, and we've had so far 9,500. I should have moved my slide on. There you go. You can see what I'm talking about now. Over 9,500 students have been involved. We're also really pleased with ourselves because we've just launched our family engagement forum and to advise us on how best to run the programme, so that we've got the perspective of people with dementia and their carers who are helping us design the programme. But we're also currently planning family webinars, regional ones, so that to help carers and their loved ones connect with each other, share experiences and provide peer support. So next slide. So this is our family engagement we call it family engagement forum, but these are people who are affected by dementia who are advising us now. So we now have 11 universities taking part. Our newest one is in Belfast, which is amazing. We've gone over the water. and we have other universities who have shown an interest. Our dream is that all universities will take part in this programme, but at the moment we've got 11 and we're really proud of that. They're all in the south, bar Belfast. It started off down in Brighton and Sussex Medical School. So at the moment, these are, if you can see on the right, this is a list of the different healthcare professionals that we're training. So that runs from doctors, dietitians, medical imaging, so that's your radiographers, nurses, both adult and mental health, occupational therapists, paramedics, and physiotherapy students. So we're reaching out to a lot of different healthcare professionals. So the students, what do? Well, the students learn what it's like to live with dementia and see firsthand the day-to-day challenges of living with dementia, as well as what helps people to live well. Before the students visit their families, they receive guidance. We do some preparatory workshops and reflective sessions, and at the end, which is really nice, at the end of the 2-year programme, we have a celebratory symposium. We bring all the students together, and we also invite families to come along to that and join in the celebration. The programme is continuously evaluated by Brighton Medical School. Over 3,000 students have helped us in that evaluation, and from the results from that work has shown that those students who do participate in the programme, they have improved knowledge, more positive attitudes towards dementia compared to their peers who haven't taken part in the programme. So this is what one student said: time for dementia has been really useful. There is a person behind the dementia, and I had made assumptions which aren't true. It's a very personal disease. So what we find with the students is that they come away realising that behind every person is an individual story and is a person in their own right. And this goes along with the values that we're trying to instill in our healthcare professionals of the future about delivering personalised care. Another student said, "It's been lovely getting to know your story," they're meaning their family. "It's not something that gets taught in lectures, and hearing your story firsthand has enlightened my curiosity of dementia." And that's one of the lovely things when the students are with their families. They are curious, they want to know, they want to learn. They're really excited when we talk to them in the introductory sessions. They're really keen to get out and meet their family and can see the benefits of this programme for when they go on to be doctors or nurses in whichever healthcare profession they're in. So for the family, so if you like, the Alzheimer's Society, the role for me, my role is to find families, because the programme won't work without families. And that's partly why I'm here today, is to not only to tell you about this programme, because I think it's amazing and everybody should know about it, but also to invite you, if you are caring for somebody with dementia, inviting you to take part. And I'll tell you how to do that at the end if you're interested. So if you were interested, I would come out and visit you at home, and I would tell you I'll tell you a lot more about the project, what's involved and the commitment and so on. And obviously there's data protection and things like that to go through. So we also do offer some other things to the families who get involved. We have a welcome webinar once a year. I keep in touch with all the families that I enrol into the programme. We have an annual, well, it's more than, I think it's twice a year now, the newsletter. And of course, we've now got the family webinar, which people, the engagement forum, so you could join our family group to advise us, and also then the webinars. So we're trying to offer more to those families who very generously give their time to us. Next slide. So this is one of our families. They've been with us quite a few years actually, and this is 2 of our students. So when the students go and visit, it's very, very informal. Here they are sitting in their garden chatting. So 300 students have taken part in the evaluation, but we've had 800 families help us to evaluate the programme. Sorry, let me just move on. Hang on, I'm talking and forgetting to move my slides on. So those families who've taken part in the evaluation have told us that it makes a real difference to them. Families feel they're contributing to student learning and it's making a difference to them as well as the students. They really enjoy the experience. We phone all of the families after the first visit, and nearly every family say how much they've enjoyed the students coming out to visit and how much they're looking forward to seeing them again, and that they would recommend it to other people. Also to note that it's a pair of students matched with one family, and that continuity carries over for 2 years. So that means that over the 2 years, the family and the students really get to know one another well. And that means obviously that the students learn an awful lot over that period of time. Also, the person with dementia, the families have told us that it's an opportunity for them to be able to engage in social interaction in a safe place. It's in their own home, so they feel safe. It's a familiar place. Any questions so far? Actually, I forgot to ask that. I'm just aware we're short on time, so it might be better if I whiz through, and then if there's any questions at the end, if that's okay.
I can't see any questions, Wendy, in the chat.
Great, okay. So this is one of our families said, we feel privileged to be associated with the Time for Dementia students, and we're strong believers that even if in a small way we can contribute to their training and future, then that's great. Roll on the next visit. Another family member said, we take part in Time for Dementia because many people aren't so fortunate and may be facing this journey alone, and we need to make healthcare professionals aware of the challenges facing carers and people with dementia. This is another family, and this is Natasha. So this is Natasha doing a home visit to enrol the family. So that's a really nice visit. It's my favourite part of the job. We get to spend about an hour and a half, 2 hours chatting to our families before they enrol into the programme. So if you are interested in taking part in Time for Dementia, you'd be joining a big programme where we're very ambitious. We're wanting all healthcare students to go through this programme, but we can't do it without the help and support of families. So if you are a carer of somebody living with dementia and you'd like to take part, you can get in touch with me. That's my a mobile phone number, and that's my email address. I'm sure that Michelle or Kath will put this on, I don't know, a newsletter or an email or whatever goes out, but we do have a leaflet that an electronic leaflet that we could provide as well. But if you're interested, I'd love to hear from you, even if you want to have a little chat through, what does it involve, ask more questions. Really happy to hear from you. Please do get in touch. It's an amazing programme. I love it. It's just so positive and makes such a huge difference. So there we are. I think if you would like any further information, that's the Alzheimer's website address with Time for Dementia. So there's a lot more information about the programme on that website, and that email address is more generally for Time for Dementia, but the other one will get through to me. I think that is almost it. Yeah, thank you.